Treatment and control of canine spirocercosis or spirocercal lupi infection. Treatment of clinical cases is rarely practical. Ivermectin, doramectin, dysphenol, levamisole can be used in the treatment of canine spirocercosis, although none of these treatments approved universally. Care should be taken while using ivermectin and doramectin because some specific breeds of dogs show toxicity to these drugs. Control and prevention of canine spirocercosis or spirocercal lupi infection. Dogs in endemic areas must be treated with moxidectin or imidacloprid at every 2 months interval to prevent the infection. However, the sources of infection, that is, dogs should be prevented from eating dung-eating beetles or food and water contaminated with dung beetles.